Have you ever experienced a sudden migraine attack and wondered how quickly your prescribed medication would bring relief? It is a common and important question when you are dealing with intense pain. For most prescribed acute migraine medications, you should typically start to feel relief within 30 minutes to 2 hours after taking your dose. This swift action is designed to stop a migraine attack in its tracks. The speed of relief can actually depend on several important factors. First, the specific type of medication plays a big role. Triptans, for example, are designed to work quickly by affecting serotonin receptors in the brain. Newer classes, like ditans or oral CGRP inhibitors, also have their own characteristic onset times. Second, your individual body chemistry and how quickly you process the medication matters greatly. Everyone is a little different in this regard. Third, and critically, when you take the medication in relation to your migraine onset is key. Taking it at the very first sign, often called the aura or early pain phase, can significantly improve its effectiveness and reduce the time until you feel better. If you wait until the migraine is already severe, the medication might take longer to work or be less effective overall. Fourth, the severity of the migraine itself can influence the perceived time to relief. A milder migraine might respond faster than a very intense one. Finally, the medication's formulation, whether it is a pill, a nasal spray, or an injectable, also affects how quickly it gets into your system. Nasal sprays and injectables generally have a faster onset of action than oral pills. To help your medication work its fastest and most effectively, always take it exactly as prescribed by your doctor. Do not wait for the pain to become unbearable. As soon as you recognize the onset of a migraine, take your dose. Ensure you are also following any specific instructions about food or drink intake around the medication, as some things can impact absorption. If you consistently find your medication taking too long or not working as you expect, it is important to discuss this openly with your healthcare provider. They can explore adjusting your dosage, trying a different formulation, or even switching to an alternative medication that might be a better fit for your unique needs. We often talk about something called onset of action, which simply means how fast a drug starts to work. Medications like triptans, such as sumatriptan or zolmitriptan, are well known for their rapid onset. Newer options include ditans like lasmiditan and the oral calcitonin gene-related peptide inhibitors, or CGRP inhibitors, like rimegepant or ubrogepant. Each of these works through slightly different pathways, offering varied timelines for relief. Understanding these distinctions helps you and your doctor choose the best option for your migraine management plan. Knowing the typical time frame for relief, understanding the many factors that influence it, and actively engaging with your treatment plan allows you to manage your migraines more confidently. By taking your medication early and communicating openly with your doctor, you are empowering yourself to find faster, more consistent relief and get back to your day with less disruption and more comfort.